Hey everyone, how's it going? It's Dr. Nate Porcher from Foundation Sport and Spine. Uh, any of you have knee pain in the front of the knee when you're going upstairs, going downstairs, working out, doing some squats, kettlebell swings, doing some running? I know with the warmer weather, we're going to have more people doing that. Sometimes there's a few different things going on, and wearing a compression sleeve or icing your knee after you run, those things alone, maybe even taking Advil or something, all those things alone aren't really going to fix your problem if there's several different issues that are going on neurologically as well as in terms of the muscular system being imbalanced. So I want to show you a good example today of a problem where we have a patient here who happens to be none other than Philip, who is Philip's got a lot of problems, which is why he's great for videos here. But Philip was doing some heavy squats at the gym during the lunch break last week. Didn't have a problem from doing that, and he regularly works out and does things like that. But he was just bending over to pick something up, and he felt a sharp pain in the front of his knee. And since then and over the weekend, he's continued to have that problem. So I just evaluated him a little bit and found that there are several different things going on where there's muscles not working. There's muscles that are what we call locked or hypertonic, where that muscle is not able to lengthen properly and relax. And he also has a couple other relationships between some muscles where one muscle is facilitated, so its function is way up here, causing another muscle to kind of be dimmed. And so when they're contracting simultaneously at different points in his movement cycle or walking, that imbalance is going to cause pain and shearing and pinching in the knee and the meniscus and some other structures that are in there. So I just want to show you kind of a good example of this case and just something that we would do to clear this and resolve a knee pain issue like this. So we're going to just check out a couple different structures here. We got, the quads here. The hamstrings are in the back. There's a little tiny muscle in the back of the knee called the popliteus, which is often a problem. And in Philip's case here, that's no exception. So one muscle that's of interest for a lot of people when they have any sort of knee problem is the vastus medialis obliquus, or the VMO. So that's this muscle that's right here. It's kind of the lower fibers of it that are oriented at an oblique angle rather than the rest of the quad, which is more like kind of up and down. And so that's where we get the name VMO. So I'm just going to test it and see how it is. So hold your knee nice and straight here. Hold. And so Philip fails on his VMO test. I also want to test for just kind of the lateral quad. So bring your knee up here. Good. That's just for me to support. We're just going to kind of rotate your knee in like that. Start with it slightly bent. A little more. Okay. Don't let me press that down. Cool. So that's nice and strong, but unfortunately in this case, it's not just too strong, it's also hypertonic, and we can do that if you guys remember seeing me use this trick here, that the muscle is not going to inhibit with normal, what we call autogenic stimuli. So here we go. Hold. And he's not going to budge on that no matter what I do. Well, not no matter what I do, but no matter how long we try to push that down, it's not going to move. So what I want to do is I'm going to do some pressure on his knee, kind of around the area where he's had pain. Pressure serves as an anti-stimulus for pain receptors, which is sometimes why when you have a knot somewhere or somewhere that hurts, just kind of like if I put pressure on it, it makes it feel better. And that's why. It's kind of down-regulating the barrage of pain receptors firing and going to your brain. So here we go. Look at the lines again with your knee bent. Rotate the foot outwards. There you go. So it's pressure, hold. And there we can get that hypertonicity to break now. So now I know that there's a bunch of pain receptors going on in here. I'm going to use P-DTR to clear those issues, those software issues that are responsible for creating a hardware problem. Okay, let me just see one more muscle here. So if remember I talked about this popliteus muscle. So if I just rub the back of his knee like this, I'm kind of quieting down some of the receptors in this popliteus muscle, and then you can have your other knee straight. And I'm just going to retest that VMO. Hold here. And now he holds that VMO nice and strong and is able to keep his knee straight. All right, so now I'm going to use PDTR, and I'm just going to go ahead and fix all these muscles, and we'll retest at the end. So here we go. All right, let's see here. Let's make sure this is still a thing. Yep, it is. Okay. Go ahead and just think about it. Okay, good. Think about it. Good. Looking right here. Good. And hyperventilate. Cool. So how long did that take me to do all those corrections? 15, 20 seconds? That's PDTR for you. Quick corrections with very powerful outcomes. So now, without having rubbed the back of his knee, hold straight here. Now his VMO muscle is nice and strong in the clear, meaning that when he's walking around, it's actually going to work. And let's go ahead. Oh, I took the lines away from you. Let's go ahead and test that vastus lateralis again. Rotate outwards here. Hold. And that breaks right away. So now we don't have those dysfunctional relationships where this muscle is locking, not able to lengthen. So it's short, pulling the kneecap this way, jamming it up into the articulation and causing some shearing through the meniscus. And now his VMO is firing, which means that his patella will track normally. He's going to have normal length tension relationships between the muscles around here, and his menisci will slide nice and normally. So a couple other things I would do. I would probably do some additional soft tissue on this muscle back here. So I'm just going to demonstrate that real quick since we got you watching. So why don't you go face down here, Philip. And something that I like to use is called vibration soft tissue therapy. So what I'm going to do is I'm just going to do, I could use active release techniques or ART to do this. But in this case, I'm using this G5 unit, which has circular vibration. I have my hand, my fingers actually underneath the towel here, our very cool, brightly colored towel. And I'm just kind of working through that popliteus muscle. So this is just going to enhance the effect of what I've already done. What's nice about this technique is that you can kind of watch Philip's body language. If I was to take this away and I start doing this, he would be squirming. You can't see because the machine's sitting there, but his head was kind of moving around. He was not liking it. So what this does is it not only helps to release the muscles that are really tight and overactive, but it also acts a little bit as a blocker for pain, kind of giving the person a distraction so that they're not really feeling too much pain when we're working on a really nasty trigger point in the area. Now, during a treatment session, I would obviously do this for a bunch longer. For the sake of this video, I'm going to quit now, though. All right. So, Philip, why don't you just jump up here and just give yourself a little move around, kind of bend the knee a little bit, squat down, and just kind of tell me if that feels a little bit different than it did before.
Yeah, feels a lot better.
Yeah.
Yeah. I don't feel any pain in my knee, actually.
Yeah, pretty awesome. So, I mean, just a quick couple corrections that we did, just clearing some of those impact paleos, some of the pain receptors in there, and then balancing out some of the muscles and getting that one muscle in particular to unlock. Very powerful treatment that we can do only in a matter of minutes using PDTR, vibration soft tissue therapy, and knowledge of how the nervous system really works. Thanks again for your time. Really appreciate your viewership. We've gotten a ton of great comments, a lot of likes on these videos, and a lot of shares. So keep doing the same thing. We really appreciate it. If you'd like to come in for treatment, you could do so by visiting our website, www.foundationsportspine.com, and click on the Book Online button. You can also reach us by telephone. Yes, we still have one of those. And the number would be 847-342-3000. If you have questions, comments, or would like to book an appointment that way. We'd love to see you here. Enjoy the rest of your week. Stay warm, and we will see you soon.